I think when we talk about social media, it's very useful to us to keep in mind the principles of journalism: who, what, when, where, why. What is a story in healthcare today? So that when we're going out there in the world on Facebook and Twitter, we don't want to just promote always, and I know I'm guilty of that myself, but you kind of want to put on maybe a little bit of a journalist hat, maybe more often than you'd even like to, with news. You know, what makes a story today?
This is how I learned I had cancer. I was flat on my back on an examination table as my bare breast was daubed with orange antiseptic. The radiologist was readying a thick needle to sample a highly suspicious mass against my chest wall. That's when she told me, or rather she uttered these words, quote, "If the pathology on this sample comes back benign, I'll consider the results non-concordant." Wait, non-concordant, I said? Like, you won't believe it if the report from the lab says it's not cancer? Yes, she said, it's my job to tell you that. Sorry. It was cold in that room, dark except for the spotlight on my chest. I was alone, half naked. I started to shake. There may be good ways to deliver there may be no good way to deliver bad news, but there are better ways than that. This year, an estimated 49,370 people will learn that they have cancer. That's about 135 per day. To my surprise, that day, I was one of them. Also, this area of the blogosphere is just growing by leaps and bounds. And whether it's people who have cancer or have had organ transplants or are dealing with a chronic disease like MS or diabetes, there are a lot of websites, of blogs out there that are recounting this. And so I kind of distinguish among various types of them. One is just the patient blog that's a diary of illness. And it's a way of kind of streamlining your communications. Like, you don't want to tell, you know, everybody that calls like the whole story all over again. And so if you can put it out there and say, well, I actually wrote about that, you know, if you want to get an update, just take a look. You know, and then save your energy for the more pressing or, you know, intense things that you need to share. So those are like the patient diary type blogs. Other blogs are like, they involve original reporting and really try to bring to bear a lot of information from experts and review books on this and talk about products that might be useful. You know, diabetes is really, you know, a good example. There's a blog called Diabetes Mind that does this, that's been going for several years now. Some people use these blogs to build brand identity and to market themselves and to look for speaking gigs, motivational speakers, you know, I survived, you can too. And then there are those that do it for grassroots advocacy and bringing the community together and, you know, arguing for a cause. Like, you know, we need coverage of, you know, this type of wheelchair or a device for measuring blood sugar or whatever.
Pancreas Center had done a fundraising walk with the Pancreatic Cancer Action Network, and they have a Purple Stride Walk, which they have, you know, they have different divisions of PanCan all over the country. But with we were doing one for the first time last November. They had tried to do a similar one in Long Island. They were only able to raise $10,000. We did this one at Columbia. They did the same kind of media outreach that they had done before. In addition to that, I was like tweeting about it. I was working with different PanCan organizations to like kind of retweet our message and get it out to as many people as possible. And instead of raising $10,000 like they'd done before, we were able to raise $315,000. Anything that you do with healthcare right now is going to reach patients. We try to do some things like getting doctors interested in CMEs, even kind of doing, you know, information about, you know, research things that they'd be related in. The doctors aren't using this just yet. There's a couple different social networks that are being built out for doctors. One's called Osmosis, and another one's called Sermo. And you know, some of them are very, like the one, some of them are very strict about You know, they verify your medical credentials to make sure that you can sign on to this. And really what they're doing though is they're creating a space where doctors can kind of, if you're a doctor in a small town and you don't have a network and you want to confidentially ask somebody else how to deal with a certain situation, you know, you can, it's a bulletin board for them to do it. In terms of marketing, you have to have a content strategy. The hardest part about setting this up is how do you keep everything updated? You know, you have to put information out there. Most organizations, they create, like I've created evergreen content, which is for us the educational and awareness stuff, so that when we want to do like a press releasing thing, like when one of our doctors is quoted in a paper and we want to put it in the, you know, put a link to it on our Facebook page, we kind of do that real time. But you can't wait for those to happen all the time unless you have a bunch of them, just because you really have to, you know, figure out how you're going to generate content.
The reason I got into social media, I'll actually stand over here, is because in the personal training industry, everything I've done is one-on-one. In the health and fitness industry, you can only, when you're personal training, you can only touch one person per hour. At the most, I was touching 8 people a day. I wanted to touch more than that. That's how I got into social media. I think I could be a lot more effective talking to the masses. At that time in October, my PPTS wellness website was getting 20 hits a month. Now, since I'm doing this blog, the blog gets 10,000 hits a month. I started with about 5. It has doubled in the last 6 months, and now my website is up to 100 hits per month. So I could say, honestly, social media has definitely helped with exposure. I have never had a referral through Google. I was never looking for Google for referrals. Now all of a sudden I'm getting people that are finding me on Google, which is pretty amazing. Also, because of my age, I have a lot of friends with young kids. I have written blog posts on how to get your kids to eat healthier. I can't tell you how many moms on Facebook that I'm friends with that I haven't talked to in 20 years have thanked me for writing a simple blog post on how to get your kids to eat a little bit more healthy. I thought this was relevant because we're at the Sharing Network. When I was interviewed to be a personal trainer, I was just doing it for the experience. I wanted nothing to do with a personal trainer. I thought I would wind up in a cardiac rehab center the rest of my life taking blood pressure and monitoring people while they exercise. But the guy on the left, his name is Ken Casoria, he said, no, let me just show you the client list that we have here. Let me see if I can convince you to be a personal trainer. Show me the client list. I thought, wow, this is a pretty special place. I could definitely do this. Unfortunately, he had an untimely death. He actually donated upon his death because he was an organ donor. He donated 6 organs, and I guess as a result saved 6 lives. So that is the person that got me into the industry. I'm just sharing that story because we're at the Sharing Network, and try to stay well, be active, eat healthy, and thank you.
So how do you stop from giving away what you do if people ask you a question that they normally would be paying you to answer?
I don't. It's not like if someone asks me a question, I don't give the answer because I'm not getting paid. I feel like the health and fitness industry has been very good to me over the years, and I'm giving back now by answering simple questions on Facebook or Twitter of questions that I receive. It's not that time consuming, and I think the goal of what I'm doing is to help people become more active and more healthy so we can prevent them from having chronic diseases such as diabetes and heart issues, high cholesterol, that kind of stuff. So if I could do my part curbing chronic disease by answering a simple question, I'll do that.